My name's Hannah. I'm the laboratory services manager. I started out working on the bench where we do chemistry, hematology, blood bank, and microbiology testing. We do testing for inpatients and outpatients here. Most people don't know that there are specially trained scientists that work in the lab. Most people think that nurses or doctors work in the lab, but we all had to have a 4-year degree and special training to work in the lab. We also take a special board exam similar to nurses. Even our phlebotomists have a state license and special training in order to draw your blood. This is Elizabeth. She's been a phlebotomist for Northern Inyo Hospital for 8 years. Right now she's drawing our patient's blood. We use different colored tubes in the lab for different tests. They all have their special function. All of our phlebotomists have to have special training, and they actually have a license through the state of California to draw blood. The different colors of tubes have different additives in them. Some of them cause the blood to clot, some of them keep it from clotting. Right now Elizabeth is putting the blood in the centrifuge, which separates the red blood cells from the plasma. We use the plasma to do most of our blood tests. This chemistry analyzer will pick up the blood tube in the rack. It'll scan the barcode that's on the tube, and based on what your doctor has ordered, the analyzer will perform the testing that it finds in the computer system. So now the tube will take a little journey through the analyzer. Your plasma will be picked up by the instrument, and it'll be mixed with different reagents. This is how we can tell what kind of cells are circulating in your body, and this can help us diagnose things like leukemia, mononucleosis. If you have an infection, we might be able to see it in the blood. So right now you're looking at some red blood cells. We might be the first ones to see a cancer cell if somebody's in the earliest stages of leukemia. And we're all trained to detect abnormal white cells that might look like cancer. Daryl is one of our microbiologists. She has special training in looking at bacteria growth on these agar plates. Some people might know these as petri dishes. And one cell of bacteria can actually grow an entire colony on this plate. The agar contains nutrients that the bacteria like and help us take anything like a tissue sample, a joint fluid sample, a throat swab, any patient specimen. We can see what bacteria are present. We're providing information about what's happening in somebody's body based on their blood work. If they have an infection, we can say what kind of pathogen is causing the infection. If they need antibiotics, we can tell the doctor what one is going to be the best. If you need a blood transfusion, we can make sure the blood that we pick out for you will be cross-matched and will be safe for your body. We really try to advocate for our patients, and we may never meet our patients, but we realize that behind every blood tube or sample, there's a person behind it, and we always do our very best to give you the highest quality test results.